This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
Last question, Prof. How do you find individuals or couples cope best after a failed IVF cycle and find the strength to continue on?
Okay. Yeah, unfortunately, an IVF cycle is far from 100% chance of success. On average, when putting back an embryo under the age of 38, there's a 35 to 40% chance of achieving a pregnancy. Doesn't sound much, but it's certainly more than twice that nature would give you in 1 month of trying. But the downside of those percentages is that 60 to 65% of cycles fail. So I spend a lot of my time talking to patients who have not been successful in their cycle, with lots of questions about why. And so I suppose in terms of coping with the fact that it hasn't worked, number one, I would say the expectation needs to be appropriate, that patients need to know what their chances of success are. I know I've talked about figures of 35 to 40% in women under 38. Unfortunately, more than 50% of the cycles we do are women over the age of 38, and over the age of 40, 25% of cycles in Australia are done in women over that age. And their chances of success, for instance, at 40, is more like 20 to 25%, not 35 to 40%. And when you get to 45, if you get eggs and if you get embryos, the odds are still only 1 or 2%. So going into a cycle with a realistic view is probably the first step in protecting yourself from some of the pain that goes with failure. The next step is to be in concert with your partner, if you're going through this with your partner, in terms of supporting each other through it. I think men feel it as much as women when it doesn't work. They want a baby as well. So it's not just the women who feel the pain. And then it's turning to experts, turning to the doctors who understand the IVF process, understand and deal with patients all the time who are struggling with their infertility journey. And so find a specialist and work with a specialist who understands things, is sympathetic, isn't sort of seeing you as the next patient in a general gynae practice where they're looking at pap smears and obstetric patients. They're actually people who concentrate on fertility, understand fertility, and give you appropriate explanations as to perhaps why things don't happen. The vast majority of cycle failures probably relate to embryo quality. When we talk about embryo quality, what we're talking about is the genetic makeup of the embryo. And when we do genetic testing on embryos, we know that a significant proportion of embryos that we put back were doomed from the start. In a 30-year-old, something like 40% of all good embryos that are put back, if we haven't tested them, are actually genetically abnormal. When you get to 40, that number jumps to 70% are abnormal. And when you get to 45, it's over 95% of embryos are genetically abnormal. And that's why pregnancy rates are so low. Even if you do the testing and you put back a genetically normal embryo, you still have a high chance of failure. It's much, much better. So, if you've got a genetically normal embryo, your odds of a pregnancy are much nearer 55 to 60% compared with the 35 to 40%. So we do make a difference by only putting back embryos that are good. So that's part of that's the major part of the conversation that we have when people are unsuccessful. Well, you do go looking for other causes. Is the uterus in good shape? Are there any immune problems? Are there any blood clotting problems? There's a collection of tests that we can do, most of which, the vast majority of which, will turn up nothing. So despite what you see on Google or read on chat rooms, really there's very little evidence that ultimately, just by keeping trying, you'll end up with a pregnancy. But it is a hard road, and obviously it's not inexpensive, but the emotional toll is also significant.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.